For years, we've been told lung cancer is mainly about smoking and genetic mutations. And while that's true, it may not be the whole story. Welcome to Science My Health, your channel for health and research information. A growing body of research suggests something else plays a major role in lung cancer risk: inflammation. Let's think about it this way. Mutations might strike the match, but inflammation may be the oxygen that keeps the fire burning. Every day, your body forms abnormal cells. Most of them are removed quietly by your immune system. So why do some grow into cancer? Researchers now believe chronic inflammation creates the kind of environment that allows mutated cells to survive, grow, and spread. In the lungs, inflammation can be triggered by cigarette smoke, air pollution, environmental toxins, and chronic lung disease. When this inflammation becomes long-term, immune cells release powerful signaling molecules. One of the most important is interleukin-1 beta, or IL-1 beta. It normally helps fight infection. But when it stays switched on, it may help tumors grow new blood vessels and expand. Here's where things get interesting. A large clinical trial designed to prevent heart disease tested a drug called canakinumab, which blocks a type of protein made by immune cells, which triggers inflammation called IL-1 beta. The goal wasn't cancer prevention, but researchers noticed something unexpected. Patients receiving higher doses of this anti-inflammatory drug developed fewer cases of lung cancer and had lower lung cancer death rates. The reduction was dose-dependent, meaning the greater the inflammation drop, the greater the cancer reduction. Importantly, this effect was strongest in lung cancer, not in most other cancers. That suggests lung tissue may be especially sensitive to inflammatory signals. This has changed how scientists think about cancer development. Many people accumulate mutations as they age, even in healthy tissue. But mutations alone don't automatically lead to cancer. It may take chronic inflammation to push those cells toward becoming malignant. This idea has led to a new concept, sometimes called cancer interception. Instead of waiting for a tumor to fully develop, the goal is to interrupt the conditions that allow it to grow in the first place. But there's a catch. Inflammation is part of your immune defense. Blocking IL-1 beta can increase the risk of serious infections because that pathway helps fight bacteria. In the same trial, infection rates were higher in people receiving the anti-inflammatory drug. That means any prevention strategy must carefully balance cancer risk reduction with infection risk. Researchers are now trying to answer key questions. Who would benefit most? Can we identify high-risk individuals using blood markers like C-reactive protein? Could lower-risk anti-inflammatory approaches provide protection without suppressing immunity too much? What this tells us is that lung cancer may not be driven by mutations alone. The environment around those mutated cells matters just as much. In the future, lung cancer prevention might not only focus on the importance of quitting smoking or detecting tumors early. It may also involve monitoring and managing inflammation before cancer ever takes hold. Leave us a comment letting us know what health research topic you want us to cover next. Like this video and subscribe to Science My Health to stay informed on the latest health research news.